talk about the circulation of blood through the heart. If you understand how the blood circulates through the heart, then that gives you a much better understanding of congestive heart failure and a lot of heart defects. You got two sides to your heart. You got the right side, which consists of the right atrium and the right ventricle. Then you got the left side, left atria, left ventricle. And of course, there are valves that separate the right atria and left atria from the right ventricle and left ventricle. The valve that separates the right atria from the right ventricle is the tricuspid valve. And the valve that separates the left atria from the left ventricle is the mitral valve. The other thing you have to understand is both sides of the heart, both the right and the left side of the heart, pump exactly the same amount of blood, but they do so under very different pressures. If you were to look, right ventricle develops a pressure systolic diastolic of 25/15, so it's a low pressure. The left ventricle, on the other hand, develops a systolic and diastolic of 120/80. The left side of the heart, in terms of the pressure that it has to generate, about 5 times harder than the right. When people develop problems in their heart, almost invariably, it's on the left side of the heart. Having said that, a couple of other things. The right and left side of the heart function as a unit. The atria function as a unit, and the ventricles function as a unit. The reason that's important, if one side of the heart begins to fail because they're functioning as a unit, blood begins to back up. As venous blood from the body, the deoxygenated blood is coming back from the body and filling the right atrium, at the exact same time, oxygenated blood from the pulmonary veins, from the lungs, is filling the left atrium. As that blood is filling both the left and right atria, the pressure inside the right and left atria is going up. When it hits a critical pressure, it's going to force open the tricuspid valve and the mitral valve. 75% of the blood that was in the atria go into the ventricle simply by changes in pressure. The other 25% of the blood pushed into the ventricles by atrial kick. You do not need atria to contract in order to live. Grandma and grandpa are walking around in a condition called atrial fibrillation. They don't pole vault, but they do okay. On the other hand, if your ventricles don't contract, you got problems. So now you've got deoxygenated blood in the right ventricle. You have oxygenated blood in the left ventricle because the ventricles work as a unit. When the left and right ventricle contract, they contract at the same time. The right ventricle, that pressure that's generated is going to force open the pulmonic valve, and that deoxygenated blood is going to be sent through the pulmonary artery. Remember, vessel that leaves the heart, regardless of the type of blood it's carrying, is an artery. And vessels that come towards the heart, regardless of the type of blood they're carrying, are veins. So in this case, the right ventricle, when it contracts, forces open the pulmonic valve. Blood moves through the pulmonary trunk and the left and right pulmonary arteries. And as you can see, the left and right pulmonary arteries get smaller until they end up in the pulmonary capillaries. And the pulmonary capillaries meet with the alveoli, and that's where gas exchange occurs. At the exact same time, the left ventricle is contracting, forcing open the aortic valve, and then sending oxygenated blood to the cells of the body. Here's the kicker. If one side of the heart fails, and the most common side of the heart to fail in most instances is the left side, and in particular the left ventricle. If the left ventricle can't pump out all the blood it received from the right ventricle, because that's where it gets the blood, then that blood begins to back up into the left ventricle, into the left atrium, into the pulmonary veins, into the pulmonary venules, and then into the pulmonary capillaries. And literally, water from the blood gets forced out of the pulmonary capillaries into the alveoli, and you get pulmonary edema. It's that simple.